Welcome to case 2 of FNA lymph nodes. This is a 60-year-old female with a rapidly enlarging left neck node. These are the air-dried Giemsa stain slides, and you can see pretty much a dispersed population of small round cells, thinking they're lymphoid probably. Searching for any cohesive groups of cells, can't really see any. Sometimes there's little collections of them together, but they're not actually growing in a cohesive group. On higher power, you can see, yes, they fit with lymphoid cells. So they've got a round, pretty much nucleus, and a small amount of cytoplasm around the outside of the cells, just staining kind of pale blue to purple. Often it's forming a bit of a sort of crescent moon around the outside of cells, but they've generally all got quite a high NC ratio. Notice quite a number have cleaves in them as well, so that's like an indent in the membrane of the nucleus. And there's also subtle but some variation in size amongst them. If we compare them to red blood cells, which is always a useful measure, they're enlarged as well. Here you can see none of these are perfectly round nuclei, they're all varying, and again you can see more indents. There's a binucleate one there, and most of them have, like these two I'm indicating, a small amount of crescent shaped cytoplasm. So these to me look like suspicious for lymphoma. They're enlarged and they're all fairly immature lymphoid cells, and they have indents in them, little cleavages and like bumps around the outside of them. Just onto low power again, so we've got red blood cells in the background, but then very much this dispersed population of cells. These are a couple of nice examples, so I'm really checking that these are lymphoid, and I'm quite happy that these two especially are lymphoid. They've got that small rim of cytoplasm around them. There's an indent in that one again, so a cleaved cell. And they're quite a bit larger than the red blood cells that are around. Looking at the pap stain slide, you can see again it's a really dispersed population. So we've got red cells staining red, and then this very kind of uniform monolayer of cells that are all at this power at least pretty much the same size and pretty much the same shape. They're not forming any cohesive groups. Slightly high power, you can see they've got interesting chromatin. It's a little bit coarse and a little bit blocky, as we call it, so it has large and small particles. Again, no groups of cells. And here on high power, we can see very little cytoplasm on the pap, but where we can see it, it seems to be quite a high NC ratio, so scant cytoplasm. And we can see maybe at this power a bit more variation in nuclear size and in shape. And we can see some prominent multiple, well not really prominent, but multiple nucleoli in a lot of the nuclei, just pointing to a couple there. So in conclusion, we've got a dispersed arrangement of fairly uniform round cells. They've got a high NC ratio and they have what I would call lymphoid cytoplasm, so just a crescent of blue staining cytoplasm. A lot of irregularities in the outline of the nuclear shape rather than just being perfectly smooth and round. The chromatin is kind of coarse and blocky, and there are multiple small nucleoli. That's not always seen in lymphomas, it's quite variable because there's many different types, but overall these features are quite in keeping